Let's talk about menopause. It's always been around, but with people living longer and going through menopause earlier, more people are working through the menopause than ever before. In fact, around 8 in 10 people affected by menopause are in work. This is a stage in life, but with 3 out of 4 experiencing menopausal symptoms and 1 in 4 serious symptoms, it's not an easy transition for all. By talking about it openly, no more taboo, and with the right help and support, we can improve that. Menopause is a subject for everyone, whether that's you personally or you're playing a vital role in being there for a partner, family member, friend or colleague. Menopause is usually defined as when a period has not occurred for 12 months. The following day is classed as menopause. Perimenopause is the time leading up to menopause, during which one may start to notice changes. Postmenopause is the time after menopause. When we talk about people being menopausal, we mean someone who is in the stages of this transition. Menopause usually happens between 45 and 55, but can occur up to the mid-60s. It can also occur earlier. Naturally, 5 in 100 women menopause between 40 and 45. And in Britain, 110,000 women aged between 12 and 40 are affected by premature ovarian insufficiency. Menopause can also happen early due to surgery such as a hysterectomy and certain types of cancer treatment such as chemotherapy. Our hormone levels change throughout our lives. The main ones that have an impact during menopause transition are estrogen, nourishes the tissues of the body, regulates bone turnover and cholesterol and maintains brain power, as well as keeping the liver, brain and heart healthy. Progesterone, which boosts feelings of calmness and aids sleep and can help to improve mood. It also helps balance blood sugar levels. And testosterone, which increases motivation and optimism, helps people feel brighter and more assertive, increases bone density and boosts sex drive. During menopause, these hormones can be out of balance. Estrogen levels fluctuate and progesterone levels decline, which is when they may start noticing symptoms. There are a range of menopausal symptoms, both physical and psychological. These can include hot flushes, low mood, poor sleep and anxiety. Everyone is different. Some may not notice any major changes at all, others will notice some symptoms, and some will experience serious symptoms. Symptoms usually last between 4 and 8 years. Symptoms can be managed in several ways. Some choose the medical approach. A GP or medical practitioner will use the NICE guidelines to determine the types of medical treatments they are able to offer. This includes hormone replacement therapy, HRT, which can be administered through tablet, patch, gel or spray. A GP can advise on the safety and effectiveness of HRT. It's a good idea to prepare notes about symptoms or changes to talk through with their GP. Plus, it's advisable to read the NICE guidelines. With more information in mind, the easier it will be to talk to a GP about what's right for them. Others choose a natural approach, including complementary and herbal therapies ranging from St. John's wort through to black cohosh. Always talk to a qualified herbalist or nutritional therapist. Non-medical treatments can also be effective in managing menopause symptoms, ranging from acupuncture to yoga. Lifestyle changes can be beneficial both during and post-menopause. These include better diet, the right kind of exercise, quitting smoking, and reducing alcohol. Certain supplements such as vitamin D, calcium and magnesium, amongst others, can help too. Post-menopause health is important. It's not just about the symptoms during the transition. Consider things like osteoporosis, cholesterol levels and heart disease. A GP can offer advice here too. The most important thing is to understand what menopause is, what the symptoms are, and to choose the right approach in managing symptoms and longer-term health. People struggling with menopausal symptoms should never be afraid to ask for help and support from partners, family, friends, and at work. It's important for everyone to talk about this openly. Menopause is a topic for everybody. Let's talk about menopause.